Hello everyone and welcome back to my channel. I am Dr. Rita, and in today's video we're going to be talking about painful menstruation, dysmenorrhea, painful cramps, period pain. Did you know that having very painful menstrual periods are not normal? So in this video I'll be addressing painful menstruation, known medically as dysmenorrhea, the two different types of dysmenorrhea, the primary dysmenorrhea and secondary dysmenorrhea, as well as the causes of painful menstruation. What should you do to help yourself if you're experiencing painful menstruation? That is the home remedies as well as medical options available for treating painful menstruation. When should you see your doctor? Because it is not normal for your periods to severely interfere with your day-to-day activity. So if you're new here, you're welcome. Don't forget to subscribe, and for my returning viewers, thank you also. Stay subscribed. Now, the first type of period pain is primary dysmenorrhea. This is painful menstruation without pelvic pathology. It is the most common gynecologic disorder common in women. In primary dysmenorrhea, there is nothing wrong with your pelvic organs, that is, no issues with your ovaries, fallopian tubes, or cervix. Primary dysmenorrhea is associated directly with the periods. It could begin just before the period starts, and it will wane in severity as the period progresses. It is usually a dull, crampy kind of pain, mostly occurring in the lower abdomen. Sometimes the pain radiates to the lower back. You could also experience nausea, vomiting, diarrhea. Headaches are also common, and dizziness. Now the question is, if there is no problem with the pelvic organs, why are you experiencing such pain? In primary dysmenorrhea, the cause of the pain is the substance called prostaglandin. Women with primary dysmenorrhea have increased production of endothelial prostaglandin, resulting in stronger and more frequent uterine contractions. Furthermore, passage of heavy clots would contribute to increased pain because the uterus has to contract to expel these clots out of the cervix. There are risk factors that can make you more likely to suffer primary dysmenorrhea. Menarche before 12, that is, seeing your first menstrual period before the age of 12. Also obesity, smoking, having a family history of heavy and painful periods, having someone in your family that is also experiencing heavy periods and painful periods, not having children also. Data shows that painful periods are not common in the women who have had children, and primary dysmenorrhea tends to improve after childbirth. The second type of dysmenorrhea, I'll be talking about the secondary dysmenorrhea. In secondary dysmenorrhea, there is a problem with the pelvic organs, that is, there is a pathology in one or more of your pelvic organs. The pattern of pain in secondary dysmenorrhea is slightly different. You may have started menstruating without pain, then somehow, somewhere around your mid-20s or 30s, you start experiencing very painful periods. You may notice this pain before your period, and then during your period, the pain gets worse and also persists after your menstrual period. You may notice other symptoms as well, such as bloating, heavy periods, bleeding between your periods, and bleeding after sex. There are several causes of secondary dysmenorrhea. Now let's go into them. The first is a condition known as endometriosis. Endometriosis is the common condition. The lining of the uterus gets implanted outside the uterus. So you can find a piece of uterine lining in the ovaries or fallopian tubes. And just as the normal uterine lining bleeds every month, this abnormally implanted uterine lining in the fallopian tubes or in the ovaries or elsewhere also bleeds. So while the bleeding from the uterus is passed out, the bleeding in the abdominal sites don't go anywhere, so they accumulate in the pelvic region and cause severe pain. Remember to like this video if you're gaining value from this content. Also, stay subscribed. Now, the second condition is adenomyosis. Adenomyosis is not quite common as endometriosis. Here, the lining of the uterus is implanted within the muscles of the uterus, so blood flows and accumulates within the muscles of the uterus during each menstrual cycle, and this could cause severe pain. The third is pelvic inflammatory disease. Pelvic inflammatory disease is the infection of the female pelvic organs, the ovaries, the fallopian tubes, the uterus, and the adnexa, that is the region surrounding these organs, mainly caused by an untreated sexually transmitted infection. Other causes of secondary dysmenorrhea include ovarian cysts, uterine polyps, and very painful periods and heavy menstrual flow may be a uterine fibroid or an adenoma. Now, how is the diagnosis of dysmenorrhea made? For primary dysmenorrhea, the history is typical. The pain is associated with the start of the period and gets better as the period progresses. There is normal pelvic examination because there is absolutely nothing wrong with your pelvic organs. If you do an ultrasound scan, you get a normal ultrasound scan as well. STI screening will come out normal. But then for secondary dysmenorrhea, diagnosis would require an ultrasound scan or an MRI, and some special tests are also required. What are some self-care tips for dysmenorrhea? The first is positioning. Some women find that lying on their front, curled up, gives some form of comfort for the pain. So if you're experiencing dysmenorrhea, or if you experience dysmenorrhea, you could try this out. The use of heat packs or hot water bottle. Some women experience relief by applying heat packs or hot water bottle on the lower abdomen. Care should be taken to avoid burns on the skin. For your hot water bottles, make sure it is not too hot, as this may cause erythema on the skin. Also, try to have a layer between the hot water bottle and your skin. Exercise also. Exercise improves the level of the feel-good hormone in the bloodstream, which can be associated with a reduced perception of pain and increased mood. This is not a high-intensity impact exercise, just gentle stretching, gentle exercise, floor exercise of gently raising your legs and positioning to relieve pain. What are the medical options available for dysmenorrhea? For one, pain medication. The non-steroidal anti-inflammatory drugs, the NSAIDs, are effective in most people and work by reducing the prostaglandin. Remember the prostaglandins that are implicated in primary dysmenorrhea. As with all medications, you've got to be careful if you have kidney issues, kidney problems, and also if you have allergies. So speak with your physicians for your prescription. Now, pinpoint the start of your period. I've made a YouTube video on how to accurately calculate your menstrual cycle. So if you can pinpoint day 1 of your menstrual cycle, you can start taking the pain medications, or alternatively, you can start the medication immediately you start feeling the cramping pains. Take your medication consistently. 3 doses drug should be taken 8 hourly, as it helps maintain the drug concentration in the body for maximum effect. Hormonal contraception is also an option. Intrauterine devices are also an option for dysmenorrhea. So, you now know some self-care tips to help you out if you're experiencing dysmenorrhea, as well as the medical options available. Do well to work with your physicians to come up with a plan appropriate for your condition. Thanks for watching. Watch my other videos also. The links will be in the description box below and also on the screen. Till I see you in my next video, goodbye.